Thanks for that terrific panel. Hi, my name is Melissa Perry. I'm at George Washington University, and I'm co-chair along with Kim Buckelhide for the Emerging Sciences for Environmental Health Decision Making. This has been profound. It's been very thought-provoking, very interesting, very engaging. We were able to cover a lot of territory as it relates to disciplinary perspectives, and it was interesting how we found ourselves oftentimes reverting to the philosophical. And in fact, as someone who has more yesterdays than I do tomorrows, I find myself leaning toward the philosophical as well. So I have the unenviable task of tying some things together, and I don't claim to be able to do that neat and tidy with a bow, but I will do my best to feed back some of the themes that resonated as I've been listening intently for the last day and a half. We have heard perspectives including epistemological, and as I see that, it has to do with how do we know what we know, and inevitably in the field of regulatory science as well as in the protection of public health, we are in the continuous pursuit of truth. And what is a hallmark of these workshops is the ability to bring together very learned individuals to provide perspectives on what we know and what we don't. And so we've talked a lot about epistemological approaches to the status of toxicity testing and the reliance on information and new information and trust. We've also delved nicely into the technical aspects of toxicity testing, and we had some great presentations that gave us some substance and some specifics as it related to assays, experiments, instruments, and analyses. And then we even touched on the societal background, which is legal, commercial, and political. The stakeholder perspectives that we were able to include were philosophical, historical, regulatory, risk and decision sciences, toxicologic, epidemiologic, demographic, community, and also product development. So that was another important perspective that we heard. With respect to the epistemological, here are some quotes that I picked up on from various workshop participants, and that included the question of whether or not the gold standard is actually the gold standard. It is critical to understand what question you're trying to answer, and the notion of honesty and ground truthing. A little bit of honesty about what we know and what we don't know can go a long way. And those were comments I think that were penetrating and at the heart of some of the sentiments in the workshop yesterday and today. In terms of technical approaches, we heard a very important quote, which was that we're doing 21st century science with 20th century methods. And I think that's an important takeaway message for all of us to poke and prod what it is that we're doing and what kinds of scientific approaches we're using. With respect to high throughput screening, we heard about all of the shortfalls and all of the delays and in some ways an incomprehensible task to be able to realize the promise of high throughput screening. We got into some great technical detail about the promise of chemically agnostic or functional assays. And I actually came up with this term wondering whether or not it would be useful, and that's not bimodal but binodal. It's a thermodynamic term to indicate that there are two processes happening at the same time and that they can intersect. And in Stan Baron's presentation, we heard about the importance of the uterotrophic assay and the results of that converging with systematic reviews. So that could well be an example of a binodal approach, not bimodal. And then also mixtures. It seems as though we kept alluding to mixtures, but we really didn't hit it head on and what that means with respect to true quantification of interactions between more than one chemical. And that was an opportunity for me to interject as an epidemiologist an approach to observational studies. So we have spent the last day and a half thinking very deliberately about experimental approaches, specifically animal, in vitro, in vivo, whole animal, and the ability to manipulate a dose. And in reality, in the field of environmental epidemiology, a lot of our research has progressed in the past 25 years, such that the natural exposures that happen in communities and environments are quantifiable, and they're also amenable to capturing associations. And so there's a real place there. It's not necessarily that linear approach to wait for whatever the tox testing says and then let's try to go into the community to test it out. In some ways, in some realms, we're really showing that it's the human observational data that have pushed and provoked further laboratory experimental approaches. So there's a true place for the human data, and that has been, as you know, an active point of debate. What is the place for human data in toxicity testing? And I would argue that there's no better model of the human than the human, and therefore relying on supporting observational research, epidemiologic research, and understanding how it needs to be factored in as it relates to decision making is something that we really have to push forward on. Societal. So John Balbus mentioned the elephant in the room, and that is the public health mandate. And it very much, I think, intersects with our discussions about the process of paradigm shifts, almost with the implication that science for science sake is a luxury of just being able to pontificate about associations. But in fact, there has to be a sense of urgency. There has to be a sense of impatience, if you will, because while we try to get the epistemology right, we are not fully responding to the mandates of public health protections. So in some ways, as scientists, we have to be as impatient as public health practitioners would be and as citizens would be when it comes to getting this right. We heard about social inequality and how that very much relates to the context in which individuals are being exposed, and that the social factors for exposure and high risk can't be ignored or overlooked. We certainly know that there is strong legal and regulatory framework, and we heard important analyses about the legal perspectives on how we make decisions about toxicity testing. We also heard an important perspective on the federal agency organizational framework, and that multiple agencies collaborating really is a meta leadership exercise. And the fact that different organizational groups within agencies have different cultures and also different mandates, and the question is coming together for collaboration. It is something talked about a lot. There are some great examples of when that happens and when it happens well. I'm a big fan of the National Climate Assessment in pointing out that a very large number of agencies were able to come together to produce a staggering amount of research as it related to priorities in climate change and climate health. And so we do have great models of agencies coming together to make decisions and to set priorities. And then the political. Then there's that, the political. And I'd have to say that we were pretty effective in sidestepping much of the political backdrop that is very much affecting the conversations that we had in the last day and a half. And as a simple example of our current political climate and milieu and how it relates to whatever comes out of this workshop would be this just out, and that is the Senate Interior and Environment Appropriations in their current proposed budget, proposing a 10% reduction to programs supporting clean water, clean air, enforcement against polluters, and scientific research. Their bill eliminates the Integrated Risk Information System, which is, as many of you are intimately aware, is a critical EPA program which is relied upon worldwide, as Morris pointed out. The bill imposes that IRIS work go into TSCA program, which of course it was not designed to do, so that's a highly unrealistic and impractical and flawed proposal. The bill also allows EPA to allocate an additional $68 million in program cuts with no restrictions. So this is the political backdrop in which we're having these conversations. So I didn't upload this just today. Honestly, I did that yesterday. This is very much what I was thinking about as we talk about decision making, and it's a useful guide to set up some form of dialectic. So Kuhn argued that there's an essential tension between established ideas and new concepts, and they arise by conflict and not consensus. So that is something for all of you to form your own opinions about, whether or not you truly believe a change in paradigm is about a conflict rather than creating consensus. Another argument, and I think this is what we have tended toward as scientists, even as regulators, as leaders of major federal organizations, we have built through consensus, stakeholders, consensus building, notice and public comment, shared governance, conferences and public forums. This is what we're a lot more comfortable with. And I thought to myself, as Thomas Kuhn was writing about prior scientific revolutions, that I couldn't imagine that conflict and disagreement and debate, active debate, was any more pleasant then than it would be now. So I don't know what that says about us and our willingness to engage in real direct questioning and pushing back of what it is that we're already doing. And so I pose it to you to be provocative. I don't have an answer, and that is there a place for direct confrontation and direct antagonism, if you will, when it comes to pushing our approaches to what is valid, what is truth. This is one way of concluding that consensus decision-making doesn't always work, can't be achieved without good relationships or without careful deliberations about the task. And we heard yesterday about the question of whether or not trust was that essential. So that came up on numerous occasions, as is confidence and the importance of confidence in being able to come to a decision. But then this is a more cynical way of thinking about it, that the incremental approach is limited for strategic decision-making, that strategic decisions are taken, whatever that are taken are of remedial nature, and the approach is known as muddling through. So going slowly and reaching consensus is sometimes seen as muddling through. And it's generally adopted by public companies, which are supposed to work under social and political pressures. At the same time, if you hold that view, I wondered what it meant for the notion of truly what is science, which is known to be incremental. Actually, our fields thrive on failure. Our fields thrive on getting it wrong and proving we've gotten it wrong so that the next time we improve to get it right. Whenever I say that, though, as I said a moment ago, it's not about science for science sake, because we truly love to pontificate about these issues. It's about making decisions with the best science possible. So again, I leave it up to you to form your own decisions about are paradigm shifts very much predicated on consensus? Are they predicated on antagonism, conflict, and confrontation, or is it somewhere in between depending on the context? The main basic messages I really wanted to leave you with is that I heard again and again it's about transparency, the absolute necessity of transparency. Whatever decisions we're trying to make have to be in the context of transparency, that our methods, our models, our assumptions, and our findings all have to be placed in the public domain and accessible. With that said, I heard comments about the plethora of information, and I channeled T.S. Eliot, who famously said, amidst all of the information, where's the knowledge? And so I think we need to keep in mind, I heard Maurice make the point that you can put all sorts of data sets, and results in front of a regulator, but if you have not formulated it in such a way that it's going to be interpretable to them, then you actually haven't really reached your goal as generating data that's intended to be useful for decision making. The other is engagement. whatever you think about the notion of consensus, it could be very conflictual, rancorous engagement. In any way, it has to be engagement. So you have to be in constant interaction with all of the stakeholders that we have represented today. And we need to keep on communicating with each other. It may not be civil, but it certainly should be informative and open and free-ranging. And then related to communication, I know I mentioned the issue about politics. I was past president of the American College of Epidemiology, and during that time I took it as an opportunity to communicate to my fellow epidemiologists the fact that they truly have a role when it comes to priority setting as it relates to research funding. And so as many of us as scientists are not comfortable talking about the importance of our field or the importance of our work or why it should be funded, the reality is there's no one better to do it than us. And even for federal employees, there are opportunities where feds can essentially communicate about what they do and what their field is independent of in their formal capacity as federal employees. And so communication in order to ensure that we're in a context of enduring funding in the coming years has to come from us experts. Otherwise, the policymakers, of which I think we have one PhD currently in Congress right now. So the majority of decision makers are not with scientific backgrounds. So it's up to us to be able to communicate that information to decision makers as to what is the critical importance of what we do. With that said, I wanted to put in a plug for future workshops. Now, as you may know, we publish the proceedings. It's not a consensus document, but it's the proceedings of these workshops. And so the proceedings from the environmental exposures workshop from last November is available. Actually, we have hard copies at the front table. Forthcoming will be the proceedings from our causal inference workshop, so please keep an eye out for that. And then save the date, write it on your calendar, 2 upcoming workshops, the promise of genome editing to advance environmental health research, that's in January, and then informing environmental health decisions through data integration, that's in February. So we hope that you'll come out for that. And for those of you that are on the web, thank you for joining us. Let me thank our fantastic organizing committee that worked really hard on bringing this workshop together, all of our fantastic speakers and contributors, and also the phenomenal National Academies of Sciences staff, including Marilee Shelton Davenport, including Keegan Sawyer and Andrea Hodgson. Thanks, everybody.